Hi, everyone. All right, today Dr. Maggie is on location, and this is going to be a fun one. She is sharing secrets and her personal experiences with unconventional treatments for POTS, tinnitus, chronic pain, and more.
Okay, girl, you're giving the whole farm away. The real question is, why the heck am I in Iowa this week? The real answer is coming up right now.
She said, "Why the heck am I in Iowa?"
Wouldn't you like to know?
Yes. Thanks for joining us, everybody. I'm Anna Manuel alongside Dr. Maggie. You on location in Iowa. What are you doing there?
Well, let's talk about it for a second. How many of you guys out there have been dealing with impossible to treat symptoms that I have experienced in my life? So let's talk about it. Like for me, how many of you had chronic headache, migraines, chronic jaw pain, right? Chronic neck pain, neck surgeries. How about numbness and tingling neuropathy?
Yes.
And how about POTS?
Oh, yeah.
If any of you who don't know what POTS is postural orthostatic tachycardia syndrome, where people get vertigo like crazy, which is dizziness with positional changes, or they get tachycardia. The heart rate is running super fast with it. It is a debilitating thing to have with POTS. How many people have POTS? Type in chat right now any of these symptoms. And I'm going to blow the lid on this. Long haul. Let's talk long haul for a second.
Oh.
How many people have had long haul and after having long haul found themselves having episodes of severe brain fog, debilitating fatigue, and dizziness with positional change, weakness, right? That you never had before. We call that vertigo. We call that tachycardia. How many people have had long haul, right? So these are impossible to treat symptoms in the conventional medical setting. And I found myself over the years having these impossible to treat conditions and figuring my own way out of it. So I'm going to go into more detail, but what I wanted to talk about, we're going to get to. I'm not holding back on you. If you know anybody right now who's suffering with any of those symptoms, type the name in chat. In fact, click the share button right now and share this video to your feed. That'd be pretty awesome. And then those of you who are watching right now, if you're watching from YouTube, give me a boom in chat that you're watching from YouTube. And those of you that are not watching from YouTube, make sure we're going to put a link of this live in YouTube right now that you hop over to YouTube right now and make sure you can click subscribe to the YouTube channel, because in about a week, we're not going to be able to directly stream into the Facebook group. So you're going to have to get notified, and to see us get notified by being a subscriber to our YouTube channel. Okay.
Dr. Maggie, we've got people chiming in from all over the country saying where they're watching from, and all over the world. We've got people in other countries watching, and they're also telling us a lot of the symptoms that they're dealing with. Many of them, things that you mentioned, and
Right.
it runs the gamut. And so many of these things are things that you personally have also dealt with. So I know you're going to share a little bit more about what it is that you've been through personally and what you've tried to do to address these problems.
Yeah, and what I'd like to do is, for all of you that are watching, if you're an alumni, you've been through any one of our programs and you've overcome any of these symptoms, type in chat what your experience is. It's really critical as a community. We share our successes, and success leaves clues. Success leads to answers. So those of you who successfully have turned around any of these symptoms, type that in chat and maybe give one major takeaway that you had that worked for you. If you can put that in chat, that'll be big love to you. I really appreciate that. All right. Let's talk about, I had it about 10 years ago. I had 2 motor vehicle accidents that caused me to have whiplash injury. That was considered soft muscle tissue injury that on an MRI and x-ray didn't show anything. Okay. So for a whole year and a half, I suffered with debilitating 10 out of 10 pain in the back of my neck to my head, all the way to my jaw. And nobody knew, and it was soft tissue. Nobody could do anything about it. Finally, at a certain point, a year and a half later, I decided, because the pain was so bad and they were just trying to get me to get on gabapentin, physical therapy, and opioids, narcotic medication, it didn't work. So as a result, I ended up going, repeating an MRI a year and a half later, and it found out I had all these disc ruptures, nerve impingements in my neck that was responsible for this chronic pain and weakness in my hand. So I had 2 neck surgeries, and after the 2 neck fusions that I had, I did better for a short period of time, and then I didn't. And it turned into, and you guys are going to start getting this, is chronic neck, like pain in the back of my neck and it went to the side of my head here, and my jaw was just, I mean, I was constantly in pain with my jaw. And because the pain came back mostly as jaw pain, I started to go to TMJ specialists, transmandibular joint specialists.
Makes
Those
sense.
were multiple dentists, multiple specialists who were dentists,
Mhm.
even functional dentists. And then I went to MDs who were transmandibular joint experts, right? And you do not believe what I went through. And I want you guys, anybody who can identify with this, type in chat. What are some of the things, any of you experiences, or am I the only one? Type in chat. I had multiple dental appliances and splints that were made especially for me. I had craniosacral therapy. Um,
What does that mean?
I know what craniosacral therapy is. So craniosacral therapy is there's multiple branch of it, but mostly you find that in massage, in people who do massage, and they work with the cranial rhythms that is going through your sinus CSF fluid coming from your head. So they do a lot of work around this area of the head. I was lucky enough to find a cranial sacral massage therapist in Portland who also did intraoral work.
Intraoral. You can have intraoral work. What does that mean? Is it like physical therapy for your mouth?
Yes, exactly. So did you guys know that there is, like, literally, just like there is pelvic floor therapists who work in the pelvic floor to deal with scarring and adhesions in this area, there is also people who do intraoral work. They're very rare and hard to find.
Yeah.
Okay. So there are physical therapists, there's some massage therapists who go into the mouth and they can actually massage like all these areas here, all these muscles that are here, all the muscles are up here, right? The muscles are in the back, behind in the back of the throat, right on the sides of each side, those muscles, they get locked up. So for the people who have severe TMJ, I've had right now 3-4 years of an intraoral physical therapy or massage in the face. And that was one of the things that kind of just kept the pain. Instead of a 10, it made it an 8.
Okay, still not great though, not a way to live. And I can just tell you, you're not alone. You asked the question, am I the only one? Boone 503 dealing with it as well, and Shelly dealing with it as well. We've got 2 people in chat also saying they've tried a lot of things, massage, craniosacral, intraoral. They're doing all of these same things. And I'm curious, are you guys getting relief from this?
Right. So I mean, and so what happened was it got me to an 8. And it wasn't until like I met through the network of people I know. And I talk about this in the book, in my book, 8 Out of the Box, which thank you everyone for getting us to bestseller lists on Amazon in 7 categories international.
That's crazy.
Okay. I talk about it in the first chapter, which is called Leading with Curiosity. And for those of you who haven't gotten the book, we got Amazon to drop the book to a ridiculous price. Okay. And I mean ridiculous. So if you want to get the book right now for a limited time at this ridiculous price, there's a link right now. Click that link and that'll take you over there. Get the book. In the chapter of Leading with Curiosity, I started like literally asking everyone and anyone what I need to do. I saw general chiropractors who did certain types of adjustments and they like helped in this area temporarily and then it wouldn't. But this whole thing in the head with literally like pain in the neck wouldn't go away. And that's when I learned about the fact that there were chiropractors who do upper cervical work.
Okay.
And I'm going to explain a little bit about what it is, but I'm going to bring an expert in because I want to really talk about upper cervical chiropractic work. And I've also at the same time also did other therapies, including also having a chiropractor who's also a naturopath do injections. But this is based on the fact that I finally figured out that the pain in my jaw wasn't coming from my jaw.
So I mean, and most doctors are probably thinking that that's the source of it, but that's not really what's happening. It's not, the pain's not originating from there.
So what I want to do is I actually want to bring an upper cervical expert in. And because I came to Iowa to see a upper cervical expert because I am a huge advocate of upper cervical work. I've been talking about it for years. I even talk about it in my book. But Dr. Jason Bradley on our team had his wife, Rachel, on my recommendations. They found Dr. Isaac Reis here, and I'm going to introduce him. And they've been working with him. Dr. Reis, come on in.
Welcome, Dr. Reis. Gosh, thank you for joining us and thank you for hosting Dr. Maggie at your facility this week.
Absolutely. It's an honor.
You know, so, and wait, so we're in Iowa and where are you? And
Okay, so okay, you're in Iowa. I'm just a couple states below you in Arkansas.
I waved when I flew over, just so you know.
Hi.
Where are you
So
at in Arkansas?
I'm in Little Rock, Arkansas. Central
Oh, you should see my friends down there.
Okay, so this is exciting. You have friends in your field?
Yes, yeah, they do the exact same technique.
So we're going to get into that, but just a shout out. Who are we shouting out in Little Rock?
So it's the Specific Chiropractic Centers, Little Rock, Dr. Grant Dennis and Dr. Cameron Daniels.
Hello, Dr. Daniels and Dr. Thomas.
Hi.
Shout out to them.
Fantastic. If you're in the Little Rock.
I'll be getting in touch, I'm sure, because as people know, and people have been chiming in from all over the country and world saying where they're watching from, it can be a challenge to find providers who are like-minded like you, Dr. Reis, who know what they're doing, who are experts in this field, and who can actually offer relief. So it's nice to know that I have somebody here in my backyard that's doing that. And hopefully, after we get some information from you and from Dr. Maggie today, everybody that's watching will be able to find a provider near them as well.
Well, we've been having big conversations this week because I discovered about 3 years ago that we have levels of the neck, and gosh, do you have a bone thing?
Yeah.
He's going to grab a bone thing. I want to show you guys some anatomy.
You know what? This is going to be a really fun show. This is just the first part of our show and tell. You won't want to miss this because Dr. Maggie is actually going to give us a little bit of a tour. She's going to be an on-location reporter today.
Okay, I want to blow the lid on upper cervical chiropractic. So let's have you demonstrate, like, what is upper cervical? Because if you look at the neck over here in the back here, you can see these are the neck vertebrae. But imagine this is the back of the head, like this is the back of my head. What are they seeing here? What defines what upper cervical is?
Yes, exactly. So we have the back of your head right here, and we have the top two. That's why we say upper cervical. Cervical means neck, vertebra in your neck. So we have the C1 vertebra or the atlas. That's what we name the office after. We have the C2 or the axis. So we focus exclusively on those bones and how they've misaligned in relation to your head.
And so what I've figured out was that the interesting thing is what comes out of these areas, like C1, C2 of the neck. Is it just about C1, C2 neck pain? What goes through this area?
There are so many things going on in here. Number one, there's a ton of nerves that run through here. You may know it as your spinal cord. That goes out to all areas of the body. That's the major communication highway between your brain and the rest of your body, both down, out, and on the way back. There's also blood vessels that run through there that bring blood to your brain. That's super important. And then we also have the cerebral spinal fluid, or this fluid that your brain floats in, that actually exits through that same area too.
So here's the thing. I mean, I had seen years of general chiropractic adjustments, and nobody was, and I didn't realize, you get your neck cracked and you didn't realize, I'm like, why is this not getting better? Mm-hmm. Why is it like the fact is, it's really hard or impossible for general chiropractors to reach C1 and C2. Okay. So, I mean, this area up here, there's all these bones underneath it. Most of the adjustments are happening down there. It's really hard to get up here. Why is that? I mean, why does that have to be so hard, and why is it such a specialty?
Yeah, those bones are very, very special. They're unique, unlike the rest of the spine. They can move in 3 different directions. The rest of the spine can't. And I think general chiropractic can be great for a lot of people. It can help with a lot of different things, but some people need the extra level of detail. So they need a deeper analysis. They need a more specific adjustment. And in your case, I really think that's what it is. We took a really, really close look at what's going on, and then we correct that. And that's what makes all the difference in the world for these patients.
So what I did, okay, did you guys know that in the world of chiropractics, there's all sorts of different subspecialties?
Yeah, I'm blown away right now that you focus just on this upper cervical area, and it makes a lot of sense. It does interact and move differently than the rest of the spine would. So it can create new challenges that you have to have a specialty for.
This is the big aha. And I want you guys to think about this in the audience, which was for me, like the big aha was like, even though I was getting chiropractic care, all this sort of massages and everything, I didn't really fully understand the landscape of what chiropractic offerings were. I didn't even know that chiropractors such big different scopes, different areas that they work with at that time, to my own detriment.
Yeah.
So one of the biggest takeaways here is if you have a problem, not only do you have to go to the doctors that you think you need, but I think it's really important to start conversations with the doctor, with the chiropractors and with the physical therapists, different kinds of doctors, and be like, well, who else would you see for this? Who else is doing something different about this? I don't even remember how I stumbled upon it, but it was one of those situations where I had an impossible to solve headache and TMJ and neuropathy. And somebody said, you got to see this guy. And I didn't even know he was upper cervical. It's just he solved impossible to solve cases. And that's who I ended up going to in Portland. And it did help quite a bit, right? And what happened was, when I was talking to Dr. Bradley about, the care that they're receiving, one of the important aspects is this: you do upper cervical adjustment, but you combine it with other modalities.
Yes.
And so this is what piqued my interest, and I wanted to bring it to you. What other, first of all, when you do your upper cervical adjustments, what would you say is so unique or special about your technique?
Yeah. So again, it's just the level of detail and specificity that we put into our adjustment. So it's in our analysis, we know exactly how to adjust you. Those upper neck bones can misalign in 274 different ways. We got to know which one, right? If you don't know,
that's a lot of options for things to go wrong.
I thought it was just out.
Yeah. To put it simply, it's out. But then we have to adjust it and get it back into a better position. We have to get your nervous system functioning. That's number one. That's the master system that coordinates everything, right? Mm-hmm. But then we can also pair that with hyperbaric oxygen therapy. So that's in your case, which is fantastic.
So we're going to go into these therapies in about a couple minutes, but I want to point something out here. What piqued my interest is that I had recommended for Rachel, Dr. Bradley's wife, she had POTS worse after long haul.
Yeah.
And these are impossible to treat cases, right? And so in our programs, when we deal with POTS, I would say 95% of POTS cases working with us in one of our programs would be resolved within a matter of few short months. But there's like that 5%, 1 in 20, that's like 80% better, but there's still 20% left, right? Of symptoms where you're like, what is going on? And I want to point out to you guys that in something like POTS, dysautonomia, long haul, there could be multiple factors that are playing into it. And what I discovered was, in my own case as well, was sometimes as you rule out certain things and 80% of it is better, one of the underlying things is, could there be an underlying misalignment of these two bones that goes straight up to your brain? Literally is from your body, those are the two bones, the last two bones that it hits before those blood vessels feed the brain. And so could it be that there is about 1 in 20 people, POTS, long haul, where this is something that's a missing link? You're about to say something.
Yeah, absolutely. I was just going to show you. This is the top bone of the neck, the atlas. This is the bottom of your head. Your brain sits right in here.
Yeah.
You can see how close that is.
Yeah, very important. This is an important bone as well. And we've got Dr. Jason's wonderful wife, Rachel, chiming in saying this and you have helped her so much. It's this combination of adjustments and hyperbaric oxygen therapy, which I think you're going to even show us what that looks like here in a moment.
And Joyce even said, this is where I'm having fun with my neck right now. I love that attitude, right? For me, I came in like hungry to learn more, but also to experience. When I deal with very difficult to treat POTS cases, the things besides our program, right? Everything we do in the program, I'm going to give you guys, write this down. Everybody with POTS and long haul right now and dysautonomia, the underlying root cause of this, believe it or not, is a huge hormonal imbalance that causes a huge blood sugar imbalance. And then also along with food allergy and histamines and digestion issues. Boom.
Boom. Okay, and this is fascinating for me because Dr. Maggie, as you're learning things now from Dr. Reis, Dr. Reis, I have to ask you, are you also learning a couple things from Dr. Maggie as you speak together?
You have no idea. Yeah, this has been an awesome week that we've had here. I've learned so much. I can't even begin to scratch the surface of that. And
opening your eyes.
More.
Yeah, to like understand even your own field in a new way, I'm sure.
Absolutely.
Yeah. So what is going on was that when Rachel and Jason, Dr. Jason and Rachel found Dr. Isaac, she started receiving the adjustments along with the HBOT. We're going to talk about what that is. And she's better. She's better. And so I said, I want to have what she's having. I'm going to try this. Because the kind of things I recommend for POTS along with our program would be to get upper cervical assessment, okay, adjustments. And then the other thing that I would recommend is IV therapy. And I'm going to shout out Dr. York Cardiology in England for an incredible YouTube channel, and a great teacher. Dr. York is at York Cardiology in England for talking about dealing with long haul and POTS via IV therapy treatment. And so one of the things that Dr. Reis does is he focuses a lot on these hard to treat headaches, but also POTS and dysautonomia, tinnitus, ringing in the ears, and neuropathy. I'm like, that's right up my alley. How about I come over and fly in and for an entire week experience all of it?
I love that you are really living by your mantra of leading by curiosity. And you're saying, you know what, I'm going to go, I'm going to search out these answers. I'm going to travel if I have to. And I'm spending the week in Iowa because I need to see what this is all about, so that now you're also sharing it with everybody else. People are saying they're so thankful for this great information. We are getting a lot of questions coming in for Dr. Reis as well, which maybe I am seeing them come in. So I'm not ignoring you guys. I will definitely, I'll pass them along to Dr. Reis when we get a moment for that.
Well, and what I'm going to say is this isn't a sponsored video. Like, he's not paying me to be here. I seeked him out. I am paying for every single treatment I have here. So I want you to know that you're getting my honest assessment at this, and honest curiosity and learning from this. Some of these things I'm learning for the first time, so I wanted to share with you. I've heard about HBOT, but I've never experienced it myself. So what I'd like to do is I want you to talk about, what is HBOT? Yeah. Is it an AI that does something?
No, not quite. So it's hyperbaric oxygen therapy. Now, a lot of people know this, especially if they've been in the diving community. So this is what they put divers in when they get the bends. And so it's really, really simple. It's all about getting your body more oxygen to promote healing and to decrease inflammation. So we have a chamber. We're going to show it to you here in a little bit. You sit inside of it. You just breathe in the air that's in there, and the machine does the rest. That's all you have to do. And again, all it's doing, putting extra oxygen, promoting healing, decreasing inflammation. And that's what makes the difference for a lot of different cases here. So we have neuropathy, number one. We have headaches. Yep, we've seen long haul. We've seen chronic pain, autoimmune conditions like lupus, crazy, crazy cool things that respond to this also.
People are saying, I love show and tell. This is so cool. They want to
I'm going to do full show and tell, but
Okay.
I want to tell you before we head over to take a look at HBOT, I am going to tell you that I have had neuropathy in my hands for 10 years from the neck injury that I've had. And I have had burning in my palms over on both sides.
And sometimes it's like 24 hours a day for you.
Yeah, and you can see it's kind of red. And it's excruciating. But at the same time, like, many different types of therapies have brought it down to like a chronic, maybe level 2 to 3, right? But there's still past damage that's happened, right? Once the nerve is dead, you can't really, I tell people this, time is critical. The sooner and earlier you intervene, especially in nerves, the more you save any nerves that are permanently damaged, right? So for me, like, I was chronically running at like probably a level more like 4 or 5, right? In these two areas right here. The rest of it has been a lot better, right? But I will tell you, I've received HBOT therapy treatment right now 3 times this week. And right now it's decreased by about 80% just in the last 3 treatments.
Wow. Have you ever had anything ever be that successful?
I almost don't want to jinx it.
Yeah.
Right? I really don't. I don't want to jinx it. Because I'm like, well, is it that I haven't been working as hard at my desk on the mouse or something like that? But I've been on vacation, like where I'm away from the computer for 2 weeks, and I haven't seen relief like this. So I am extremely intrigued. Okay. So it is working. I'm going to tell you guys that. And for sure, it's something I'm going to pursue when I go back to Portland. But I want to do some show and tell. You guys ready for this?
Get up and get moving. And trust her.
All right. We're going to walk around here, and I'm going to go ahead and we're going to turn this camera around, everybody. And we're going to show you what is an HBOT.
Okay. And they come in different shapes and sizes, because I'm actually surprised to see one that looks like this. I've got one near me that you kind of look like you're laying in a coffin.
Yes, so there's 2 different kinds of HBOT. We put it very, very generally. So you've got a horizontal chamber, which looks like a big tube. And then you've got a vertical chamber, which is what ours is. So you can see it's nice and upright. You sit inside. It's actually wheelchair accessible. We can pull the chair out. We can roll a wheelchair right in if we need to. But it is fantastic. Here, let's see what Dr. Maggie looks like while she's sitting there.
Let's get you sitting in there. And is there any window or anything that you can see out, or are you kind of just in it? Okay, so
we've got 3 windows in here. We've got 1 on the front and 2 on the sides. Yep.
Okay, so that's really helpful. So if somebody might have claustrophobia or something like that, you can see out. This is something you can easily get out of should you need to.
I was like, this is my executive office.
You were loving it.
You're shooting videos in there and everything.
I shot some videos in here earlier in the week, and I could have my team show some of those videos while I was in here earlier last week. But it was how long would you say the sessions were?
Yeah, that's what people want to know. How long do you stay in there?
Yeah, they're about 90 minutes. So why it takes so long? We bring you up to pressure, it inflates, it blows up like a big balloon. And then once you're in there, we start the timer and you give you a full 60 minutes. That way we know that you're getting the maximum amount of oxygen that your body can absorb. And then we just got to bring you back down and let you out. You asked about people being claustrophobic.
Yes.
So you saw when Dr. Maggie was in there, she had plenty of room. She could put her arms out. She could put her arms above her head. She had room for her legs. There's plenty of room. I've had people with claustrophobia and wanting to avoid small spaces, and they've done fantastic. I've had no issues so far.
Can you listen? They want to know, can you listen to music in there?
Yes.
I watched Bridget in there and had some unholy thoughts.
So you absolutely can. And ours, it is safe to bring your phone in there. You can bring your iPad, so you can do a little work in there. You can have your headphones. So a lot of people bring a book or a newspaper or magazine in there and they read, or you can just kick the chair back and take a nap.
So what does it feel like when you're in there? I imagine if the pressure is changing, you might notice some things maybe with your ears, or what does it feel like when you're in there?
Yes, definitely. So I described the sensation. It's most similar to flying in a plane. So as we bring you up, we want your ears to pop. That means that the pressure is evening between your ears and in the chamber, and that's a good thing. And so your ears will pop on the way up. They'll also pop on the way down as we bring you back down to normal room pressure.
Okay, fascinating. And so then is it something where you like to do an adjustment before or after this treatment specifically?
Yes, absolutely. So with our technique, what I really, really love to do with patients is we will adjust them, and then we actually rest our patients, but we just have them rest in here. They can kick the chair back, let their adjustment settle in, let their nervous system take that adjustment in and adapt, so we can measure it on our scans later. But it's perfect. They can rest. It's a 2-in-1. They get hyperbaric oxygen therapy and it's post-adjustment rest.
And so I'm just curious, pure oxygen is the answer for so many people, but why? How does this work in helping us?
Yes, absolutely. Again, it's just getting that in there so it can do all the work. It's going to help decrease your inflammation levels. It's going to help carry that to wherever it's needed. If there's any sort of damage or there's any sort of issue, it's going to go in there and help to promote the healing so that issue, especially if we talk about neuropathy, it's about the nerves and the blood vessels, or in Maggie's case, the hands, not getting enough oxygen. Now it can. It's perfect.
How long do you expect her results to last? Do you need to continue to do this therapy on a regular basis?
That is a great question. It depends on the person. So Dr. Maggie and I were talking about this earlier in the week, actually. So how long will the results last? If a person goes right back to their old lifestyle, especially when we talk about neuropathy, they're eating a ton of sugar, their hormones are messed up, and they're not doing anything to help that, the results may last a month, they may last a few months. Now, if they're starting to actually do things that are positive for their health, managing their sugars, getting their hormones under control, with the help of somebody like Dr. Maggie and the Transform team, your results are going to last a lot longer.
Okay. We've got some questions, specific questions coming in for you. If I can just ask you, unless Dr. Maggie wants to take us somewhere else, but somebody wants to know, how do you know if your neck is out of line? Like maybe you're not experiencing obvious pain. And I think we just lost that video for a second.
Wait, so what I want to do is, since we're moving to questions about it, I want to talk a little bit just about, do you want to show them the adjustment table that you do? And then maybe we could even Jonathan, if you can pop up the B-roll a little bit so we can show the x-rays and maybe a little bit of what's going on with me.
Oh, would love that. Yes. Okay. More show and tell. Yay.
We'll get to questions. Okay. So in the world of upper cervical, our technique is called a knee, chest, upper cervical. This is the table that we use. It's custom made for us just for this adjustment. So we'll have your knees down there. The top of the chest sits right here. Your head is stationary on the table. It doesn't move. There's no quick twist or anything like that. Okay. And so our adjustment, you'll see it on the B-roll here in a second.
So I'm going to have Jonathan pull up and show you guys the video of my adjustment right now.
Love it.
Okay. I like that he's saying there's no quick twist as he's doing this, because that is what scares people. Yeah, we're seeing it right now. We see Dr. Maggie with her knees down and laying over that table.
That's it.
That was it? Wait a minute. Can we watch that again?
That's
Because,
simple.
okay. So explain to us what you're doing here.
Yeah. So when we have you on the table, we're making sure that your head and your neck is stable. We can then find whichever bone we're going to adjust. If that's the top bone in your neck, the atlas, or the second one, the axis. There we go. Then we can actually get on that bone. We can make our adjustment and then come right back up. And the best part about it is you see right there that we're just getting on this one spot.
Yeah.
It's a really specific spot.
Yes.
Different than when you typically think of someone going whoop to your neck, and that can
Yes.
scare some people because you're like, are you going to break my neck? What's happening here?
Absolutely. I get
This
that
is
all the
this
time.
seems more gentle.
It is. It's a lot more gentle. A lot of times with my adjustment, I really don't even hear a click or a pop. And to be honest with you, I'm not concerned if I hear a click or a pop at all. So one of our questions was, how do you know if your neck is out of place, right? How do you know if you have this problem?
Yeah.
So
Let's keep talking.
yeah, one of the things we utilize infrared thermography. So
Do you want to show him
heat
that?
scans. Yeah.
Show him the heat scans.
Yeah.
Yes.
Oh my God. Right after my adjustment, he was able to tell if it's set right and how it's functioning, a functional assessment.
Is that because the heat set scan would be lessened? You would have less heat in that area?
Kind of. It's very similar to that. So how it works, we measure the heat that's coming off your neck. The amount of heat and where it is on your neck is actually controlled by the nerves. And so by measuring the heat, we're measuring your nerves. And what we want to see is everything improve.
Hey, show him the device.
Yes. Okay, here it is. That's
Oh.
what
It literally is a roller that rolls up my
it just
neck.
rolls right up the back of your neck. These are the thermometers right here that measures the heat. And then it puts it on a graph like this for us.
Okay. All right. Yep. Zoom us into the graph. Tell us what that graph means. What are we looking at?
So we got the heat on the left side of the neck and the right side of the neck. And then this is our comparison between the two. And really what we want to see is 3 straight lines. We want to see it be very similar on the left side and the right side. And when it is, that makes this one straight. That's our goal. A lot of patients, when they come in, their scan is very wavy, a lot of curves and swings. And generally speaking, that's not what we want to see. We want to see more straight. So give me 1 second here. I'll get that pulled out. So you can see this has got a little bit of a lean and then this bump up here at the top. And so that's what we're looking to improve with our adjustment. We're unlocking that nervous system, seeing the change right there.
Okay, we're gonna pop back to our other location, and we're gonna answer some of these questions because I have received several adjustments. I've had a post-adjustment assessment to check whether the adjustment held and how my neck is functioning. So let's answer some questions for people.
Well, and I want to ask you, number one, Dr. Maggie, what kind of relief did you notice? Obviously, you got relief from the hyperbaric oxygen, but when he was we were watching the video of you getting that adjustment, could you immediately feel relief after that, or what was that like?
So here's something interesting. Immediately, I don't feel relief.
Okay.
I actually felt a little click. And typically in the past, when I've received upper cervical adjustments, I would never feel any sort of clicking or anything.
Mm.
But every time he adjusts me, for some strange reason, it seems like he's hitting the A spot just perfectly. And I feel a little click right there, right? Go ahead.
I was just going to say, really what she's feeling, if that bone is out of place like this, she's just feeling that move back into place very gently. This is only a few millimeters. It's not a big adjustment at all, but it's a big difference in their life when they do.
So what happens, I had the adjustment. You don't necessarily feel anything different. I go in the HBOT, and about an hour later when I'm out of the HBOT, the first treatment, this headache that I've had here for 3 years, that goes with the jaw, this headache right here was gone. It just felt like there was like this whole release of pressure on the right side of my head. And I didn't want to jinx it. I did make a video talking about it, but I'm like, I don't know if I want to jinx it or not. But over the past 3 days, that headache over here has been gone. And here's a very weird change, okay, is that anybody, all the jaw people that I've worked with knows that when I open and close my jaw, there would be an audible pop. And you could, and it would be audible even farther out. You could hear almost like that from there. It's there, but it's like about 20%.
The pop is diminishing.
You know, it's not even symmetrical. If you guys look at my jaw, the years of this makes it very asymmetrical.
Oh, wow.
And just at the very end, there's a slight click right now. So it's really weird, but I've never had any sort of treatment or adjustment where like I would have any change in the level of that popping. And this whole week, it still pops, but it's like 20% of the of what it used to be just about a week ago. So I'm really fascinated.
Well, and two things to point out there. Number one, we didn't actually touch her jaw.
Nope.
That's and two, she said 80% better in 3 days.
Amazing.
On Monday, and it's
Yeah.
Thursday now.
Yeah.
Yeah.
I'm like,
These are the kind of unsolvable cases that Dr. Maggie gets all the time.
I know.
Yes.
Well,
You
this is what,
as well.
so this is the conversation we've been having, because I was talking about, because I was like, do you get such dramatic improvements in neuropathy like this in somebody? And you brought up a case where there was a man.
Yeah.
Talk about that case.
Yeah, definitely. So this was actually a chronic pain case, is head to toe pain. And what we've seen is even just in a couple of sessions, the amount of medication, pain medication that they needed was reduced by half in 2 sessions.
Well, and I said, is this typical? And his answer was, I've been chasing it ever since, in some ways, that perfect case.
Yeah.
Because the thing is that if you're the 1 in 100 people, if you're the 1 in 100 where the only cause of your neuropathy is a C1, C2 misalignment, you will get complete relief, right? But most everybody I work with neuropathy, there's multiple causes. And we were just talking about how I was telling him, like, well, people don't realize that a lot of times these cases is because of underlying like huge hormone imbalance. And when your hormones are out of balance, it straight shots to blood sugar hormonal balance. So then their blood sugar is going up and down like crazy. Mm-hmm. And then we're dealing with more and more people with food allergies. We're in Iowa. We're in the middle of heartland farming for the country, right? Where, we are dealing with situations with, commercial, agriculture, big ag. So there's some issues that come along with that, with our food supply chain and increasing food allergies in people. So those things, there's an order with which we work through all of those in a very quick and successful way, to which I don't care which of those problems you have, 95% of people within just probably about 2 months, most if not all their symptoms are gone. But I told him that 1 out of that 20 still is going to have some symptoms. And that's when I'm like, we've worked through the order to eliminate all the things. So now that makes it like bingo.
Exactly.
And that person, when they go get upper cervical, is like his hallelujah case.
Exactly. My favorite ones. Like she said, we're just going right down the checklist. You've already worked with Dr. Maggie. And so you have this remaining issue after she's corrected everything else. And that's just like a big neon sign for me. That's where we got to work. That's what we got to do. And those patients tend to respond exceptionally well. Like she said, 80% better across the board in multiple issues within a week.
Right. But Emma Info Dumps, we just had Emma interview with us last week. And you guys know, how many saw the interview with Emma? Type in chat, Emma with an exclamation mark. Okay. So Emma, we interviewed her last week. She has had POTS-like symptoms. She's right now 23, and it was really severe the last 3 years, starting at the age of 19. Now think about this. She has POTS, and I didn't even know she had TMJ until she just typed this. It's transmandibular joint. Now think about this, and her symptoms I think are 90, if not 100% resolved already. But like now she's connecting the dots. What about the TMJ? She's had TMJ since she was 17. So for the last, Lisa saw her. So she's had TMJ for the last 5 years, and now you're starting to think, is there a C1, C2 upper cervical issue for Emma? So that, let's say she has 5% of symptoms left. Is this going to be the Holy Grail?
Right.
And this is why the order really matters.
The order matters. You're getting relief. And it's also valuable to rule out, okay, what's not the problem, right? Because that can be just as helpful sometimes as knowing what is the problem, what's not the problem, so we can find what is going to be the cause and what is going to be the solution here. Okay, so many people are dealing with TMJ. A lot of comments of saying, I'm dealing with this too. So, tons of people, dozens of people have written in that they're dealing with this.
So let's go back to the question, which
have some questions for you.
What are the signs that someone has a upper cervical misalignment?
Yeah, and I mean, the symptoms can be very broad. Anything from TMJ, jaw clicking, popping, pain. We can have facial pain sometimes. Something we haven't talked about with Dr. Maggie is occipital neuralgia, so pain up the back of the head,
what I had,
causing headaches and migraines. And a lot of these issues are very, very chronic. They haven't responded to anything else. These are the impossible conditions that she was talking about. But it may also jump into things like anxiety and trouble falling asleep, not being able to stay asleep. Therefore, you're waking up tired and not well rested. So you're chronically fatigued. These patients may also have digestive issues.
Tons.
A lot of these issues are connected to the neck that they never knew about. And so when they come into the office, especially if they've already worked with somebody like Dr. Maggie, and some of the hormonal issues and other things are corrected, it ties a lot of their symptoms together.
What kind of digestive issues are we talking about? It could be across the board, or is it specific to constipation or what?
Go ahead.
Slower motility. It's interesting is that, so when we're looking at the upper cervical, we're looking at some of the ganglion and the nerve things that are coming through here. We're talking also about these nerves that we call the autonomic nervous system. So we have a nervous system where there's a balance between your fight or flight, which is a sympathetic nervous system, and the parasympathetic system, which is your calm and regular workhorse, right? And digestion. So calm and work nervous system. So what you find is when people, and I can speak from personal experience, when my C1 or C2 is out, it's like, number one, it's like the brain fog is horrible. The sense of anxiety and overwhelm and being unsettled is awful. Okay. And then also just depression. I know my C1 is out even a little bit because I will get depressed. And it's like a telltale sign. I just know it. And you're just doom and gloom. And all of a sudden everything's just horrible. And there's no reason for it. And I almost know emotively that my C1 is out more than like a physical pain symptom. So people who really have had C1 and have understood, like when they get adjusted, when they're out of alignment, will know that there's a whole like emotional component to the upper cervicals being not being misaligned.
This is fascinating because so often you might just think you only know you have a problem if there's specific pain radiating from that area, but it goes so much deeper and it really involves so many different bodily systems, including your emotions and how you're feeling. Okay.
I want to put a couple things I want to pinpoint here. Anybody who has POTS or dysautonomia, I have a 6-part training that's free for you guys to get. If you want to get the 6-part training for POTS, type in chat POTS, P-O-T-S. In there, some of my top trainings that I've done over the last 6 years have been included. So it's a 6-part training on how to end POTS on all the root causes we're just now talking about, just to make that clear. Okay, number one, type POTS in chat, and then we'll also share, later on, we'll share a link for you guys to get that 6-part training too as well, because you know what? I eat POTS for breakfast. I really do. It is an easy problem to solve when you know the order with which you got to go and work on and eliminate in this complex problem, right? Secondly, let's clear up a couple things. People are asking, is this, what is upper cervical? And I want to be clear that there's multiple branches of upper cervical chiropractors. And without getting to too much specifics, do you want to name the 3 different branches?
Yeah. So were you thinking structural and functional or
because someone just asked, is this the same as NUCA? Are we talking about NUCA, right?
Yeah. So that question. Yeah, fantastic question. So it's a little bit different, the technique that we do here. NUCA is a little bit different. Their approach is more structural. And our approach is really through the nervous system, through our scans. And so we want to measure and see how that's working. NUCA, we want to get your head and your neck as straight and orthogonal, as they call it, as possible. And if we also jump into
so they will look at my head and they'll assess just the tilt of my head. And I've seen NUCA for 10 years. So they'll look at you visually, and they're trying to visually get you to be in alignment with your head tilt, right?
Yeah. Yep. And so NUCA adjustment does that by hand. So they're really focused on getting everything lined up with a hand adjustment. There's also other techniques out there that use an instrument. And so they're doing the same thing. They're trying to get the head and the neck and the atlas bone all in perfect alignment. Now, with our type of care here that we have in the office, again, focused on that scan and on your nerves and your nervous system working properly. We love to see the head and the neck in the best position possible, but the nervous system function is number one. That's what makes the biggest difference for these patients, especially when we talk about dysautonomia, which is dysfunction in the nervous system, right? The autonomic nervous system. That's what we're measuring with that scan that we showed you earlier.
Okay.
Speak up a little, please.
Yeah.
Okay. So a couple things for me, like I've experienced NUCA, and I've also experienced Dr. Reis's technique with hand, No, knee, chest,
Upper cervical.
knee, chest, upper cervical.
Yes.
Is there like a acronym for it?
KCUC. Didn't say that.
Dr.
KCUC.
Maggie's really good at making them up. Okay,
I
by
made
the
up
way.
things like
Or just say knee chest.
like
That's
the
fine
three
too.
knee chest. All right,
Yeah,
we
let's
got
do
it.
that.
All right. So what I noticed as a difference is that when I did the NUCA, there was a visual inspection by the chiropractor of whether the adjustment was successful. And with Dr. Reis, he actually is measuring it with an infrared temperature probe. And visually, then I can actually sit next to him and actually see my before and my after, just the functional. How are the cells functioning? So it's a functional assessment of how the cells, the blood flow is working in your neck after an adjustment. So that's one key difference that I noticed. Okay. Another key difference is the style of table that it is. And when my head tilt in that particular way, in that particular position, even before he does any movement, his hand on it, I could tell he's actually has more access to the atlas than any other doctor has.
Yeah, which is great. We were going to talk about this, in fact. So this is the model again of your neck and the atlas bone right here. We're going to talk about an atlas adjustment specifically. So when you're on that table and you turn your head, that opens up the whole side right here for us to contact, which is fantastic because this spot, let me find the right angle for you, right here is the strongest part of the atlas. And so we're getting right on that strongest part. It's nice and opened up for us. It's already at tension. It's just ready to move and click right back into place. And that's, again, what's going to change our scan.
So we got a lot of people in chat asking, can we recommend similar practice? How do we find chiropractors who do upper cervical work, right? That's a big, hairy question.
Yes.
What do you have any recommendations?
And what kinds of credentials and things in their office should you be looking for when
Well,
seeking
first
out?
thing first, I want to say if you're in Iowa or you're in the Iowa vicinity, I mean, Chicago, it's worth a drive to come to Atlas Pacific Chiropractic here in Iowa. And that's number one. It is not easy actually to find a good upper cervical doctor, okay? Because it is a subspecialty of chiropractics. Don't go to a regular chiropractor asking for this. I'm going to just tell you this, and I've kissed a lot of frogs. So how would somebody go about if they can't come to Iowa? How would they go about this?
Yeah, and I think one thing to keep in mind is it is very tough to find an upper cervical chiropractor. We make up about 1% of all chiropractors. Not very many, right?
Yeah.
And so it's something that small. It's hard to be known. It's hard to be found. And so there's a new website out there. It's called uccnearme.com. So find an upper cervical chiropractor near me, right? As simple as that. You can get on there. You can search by location. So say you are in Arkansas, you can find somebody in Arkansas. If you're in Florida,
Dr. Thomas.
Yeah, exactly. If you're in California, we can find somebody there too. If you're even overseas, there's all sorts of upper cervical chiropractors out there in England and in South Africa and other places. So we can get you the care you need. Or we can have you fly into somebody who's willing to take care of you.
Yeah, I flew in and because I wanted to experience specifically this type of upper cervical, but also the combination of HBOT, and not to even mention I had some body work done as well as IV therapy. So if you're dealing with POTS, and I really love Dr. York from York Cardiology. Shout out to his YouTube channel and Dr. York. For his, he really talks through why IV therapy, like once a week or twice a week, has been critically helpful for his people with POTS and for his people with long haul.
For people who don't know, Dr. Maggie, when you say IV therapy, we're talking about the infusion of what specific vitamins into your system?
He's just doing saline, salt water, sterile salt water that's in the same pH, the same salinity as your blood, just infusing IV fluid. And so I really admire his work, and has really complemented the work that I do, because there are some patients who do and can benefit from IV therapy, intravenous fluid administration once or twice a week. And it could be just saline, or some people will do a vitamin and others. So for me, because I work with people's hormones, I work with some of their nutrient deficiencies. If I was recommending IV therapy, I wouldn't just necessarily only do saline. I would be basing on their functional labs and what their symptoms are. I would be adjusting it by adding additional vitamins and other supplementation in there as well. But that's not necessary. It's not critical. Dr. York's protocol is really just saline IV therapy. So when you're starting to look at now you realize, oh, hint, long haul discussion. Are you guys ready for some long haul discussion? Write long haul in chat if you want to talk about long haul. I have some secrets to spill on long haul. Who wants the secrets on long haul? Type in chat, okay? So I'm going to give you guys the lowdown on long haul, okay? Long haul is, the virus, and it infects multiple organs. It loves the lungs and it loves the gut. And believe it or not, it loves to shut down your hormones. Okay, I'm just telling you. And I think he had a case with this, but and I point this out, and I'm the only doctor who says this, because you know why? I am the hormone doctor, and I've done tons of testing on people post the big C. And what I found is people with the big C, many of them, the vast majority of them, have hormonal shutdown for anywhere from 6 to 12 months after.
6 to 12 months shut down. That'll really throw your system off.
Well, why do you think people have brain fog? Why do you think people have anxiety? Why do you think people have the heart rate changes, the chronic fatigue and all this stuff? And why do you think some people get hot flashes, severe insomnia. Some people, long haul can feel like menopause. And the other part of the issue is that the big attack on these hormones, which is what we work on a ton. And then people will find increased sensitivity to food allergies because COVID infects the gut. So thank you, Lori, right? So these food allergies and the histamines that are made from all these food allergies dilate blood vessels.
Wow.
And so increased food reaction, digestion problems, food allergies, increased histamines, dilate blood vessels, dropping blood pressure, making POTS worse, along with hormone shutdown, which makes blood pressure worse. Yeah.
This makes so much sense. My best friend actually is a long haul sufferer, and that was her primary symptom, was the hot flashes. She would all of a sudden, we would be sitting there and she would start to almost like sweat. And it was as a direct result, she was told, because of long haul. And we never knew the method or the mechanism as to why this was happening. A lot of people are saying, OMG, this is like such great information.
Well, so for me, being Dr. Hormones, I'm able to be Dr. Potts with this because I realized there's a really unique connection. And you had a case.
Yeah. So a girl actually stopped having her cycle, and it's crazy. They haven't been able to sleep
since COVID. Yeah.
And I've seen many, many other things too. People have had to quit their jobs because of COVID. They were on inhalers and unable to work and unable to function because of COVID, because of long haul.
Yeah. And so for me, we work a ton with long haul in many of our different programs. And interestingly, in my hormone masterclass, which is our hormone program, a ton of people with long haul actually are in my hormone masterclass, and they're discovering just the impact that the big C had on their hormones and how to fix it. It's fixable. This is a solvable problem. Okay. POTS, long haul are completely solvable problems. Okay. But you must be able to assess, learn, and address the hormonal imbalances underneath, which is why I'm going to tell you guys, if you're interested in learning more about hormones or my hormone masterclass, we have a guide and a 6-part training. We have a guide and training all around hormones. So if you want the hormone trainings along with the guide, it's free. Just we'll put hormone guide in chat and we will get it to you. But there's a huge link between hormones, COVID, long haul, and POTS, just so you guys know. And in fact, when you look at the definition of what long haul is, look at the symptoms, is nearly identical to people with POTS.
Oh my gosh.
Because, yeah.
Great information. Do we have time for a couple more questions? Maybe rapid fire even? Okay, because we got a lot of good ones in. Okay, so rapid fire here. Lisa says, how is this, number one, is this different from the kind you might see, the hyperbaric that you would see in a hospital?
Yes, it is.
And in what way?
Yep, so it's a little bit lower pressure, which lower pressure actually means it can be a little bit safer. So we don't have to worry about your eardrums rupturing.
Okay.
Those high pressures, that's an option. That's a a risk per se. We're also using concentrated oxygen, so it's not pure oxygen. We're using a mix, and so that means that it's a little bit more safe too. That's why you're able to take your phone in there and use that, because it's not as flammable.
What's the amount of oxygen? Can you say? Do you know with specifics?
Yeah, so we put 90 to 95% oxygen into our chamber.
Yeah.
And again, that's the reason you can have your phone in there. So that makes it more enjoyable for people too. But this lower pressure hyperbaric, it can be good for longer chronic conditions. People can actually get these and put them in their house.
That was another question somebody had. Is can you get a home unit? They want to know.
Yeah, you can get these and put them in your house, which is fantastic. You know, you can always go to an office like mine, but say you have something where you're not able to travel, you can have this there. It's an amazing tool that you can utilize. And it's good for so many different things. We've already talked about how many already. Yeah. Neuropathy, long haul, POTS,
headache.
Headaches.
We already know, for example, in the medical world, that certain types of headaches, including migraines and other types of headaches, we know giving high concentration of oxygen actually can immediately relieve headaches. That's known fact, medical. So this is why in the hospital, they'll administer oxygen sometimes for certain types of headaches as a treatment in the emergency room. Now imagine putting that oxygen with some pressure to make sure it really gets in there, how much more effective that is, right?
Yeah.
Much more. And then Lisa's really good with the questions here. Her last question was, is it something that you can just hop out of, or do you have to wait because of the pressurized changes?
Yeah, that's a great question. So it takes about 10 minutes to get up to that pressure, and then we can bring you down at whatever rate is comfortable for you. Some people can be out of that chamber. We can open it wide open, and they can come down in about 1.5 minutes, 2 minutes. Some people, we take the full 10 minutes to bring them down. It's whatever you're comfortable with. And yeah, you can do a shorter dive. You could do 10 minutes, you could do 15 minutes, 30 minutes, but 60 minutes is the magic number for most people, where they're going to get the maximum amount of oxygen and then not be in there too much longer after that. That's why we do the 60 minutes at pressure.
Okay. Some other quick specific questions of, does your practice help with certain kinds of conditions? We talked about so many, but then I know people are dealing with others like Bell's palsy. Do you ever see anybody that relates to Bell's palsy? Okay.
Yes. Yeah. Yes. Bell's palsy is just a form of neuropathy, everybody. So what is Bell's palsy is that literally a virus will infect this area of the nerve, and then as a result will cause the area of from the nerve root out, will cause that area to be numb. Okay. So then your face is suddenly weak, and then you lose feeling or ability. And how many people has a Bell's palsy? Type that in chat. And so the thing is that it's still from a viral infection. And so most doctors will give steroids for that situation. But the thing is that we talked about neuropathy and how oxygenation of the nerves is really important in its healing. One of the things I noticed was, like, sitting at the magic 60-minute mark, I felt like this pressure literally released in this area. I can only imagine how it could be helpful in Bell's palsy to relieve the pressure and the inflammation in the nerve here.
Absolutely. And even in other conditions like trigeminal neuralgia.
Which is what I had.
Yep. I don't know if you guys have heard of that one. They nickname it the suicide disease.
It's awful.
The pain is so intense that these people, they don't know what to do. And so, yes, it absolutely can help those people. I've seen it firsthand. It can improve dramatically, even with one adjustment. Now, I think more adjustments is going to be necessary to keep it at bay, really correct that issue. But yes, short answer is yes.
And thank you for that answer. What about somebody with Chiari malformation, which is, okay, where is that? Explain what that, am I saying it right? First of all, Chiari malformation. And is that when the brain can extend down into the spinal? Is that right?
Yes, that's a fantastic question. Okay, so we got our model, right? Right here at the base, you can see that hole right there. So that's where the cerebellum sits. And when the cerebellum starts to work its way down out of the head through the hole right there into the upper neck, they call that a Chiari malformation. And yes, upper cervical can be beneficial for Chiari. These patients tend to have a lot of crazy neurological symptoms, a lot of headaches, a lot of pain, a lot of muscle spasms.
I just found out yesterday I have a partial Chiari malformation.
What?
Oh, well, you've responded.
I didn't even tell you this yet.
No, I had no idea until just now.
I didn't know till yesterday, because if you guys hadn't seen, I actually was getting a MRI over the weekend, and I just got the results yesterday, and I found out that I had a form of Chiari malformation.
Yeah, they can do fantastic. I know I've had colleagues in some circumstances that adjusting the atlas, adjusting the upper neck, they've actually seen the Chiari improve.
Oh, wow.
So that cerebellar tonsil is what they call it, or that part of your brain working its way back up into the head where it's supposed to be, just from adjusting the atlas, just from adjusting those bones.
Amazing. Okay, we mentioned it off the top, but tinnitus. How helpful is this with tinnitus?
Huge.
Huge. So Rachel will tell you, Dr. Jason's wife, Rachel, was the one. And I think it's just apropos that in the Facebook group, we had a post about tinnitus, which is ringing in the ears, which is really annoying sound in your ear. And this is one of the bane of the ear, nose, and throat doctors' office, that it's very difficult for them to treat because there's multiple factors associated with it, right? And people don't realize there's bony structures involved, there's nerves involved, there's space in here involved, there's inflammation associated. There's also nerves coming from the neck involvement, which we're going to talk about. But I have found that in people going through our program, believe it or not, you can take this to the bank, but one of the underlying reasons for why people have ringing in the ear tinnitus is, believe it or not, food allergies and elevated histamine levels. Just so you know, that's one of the things, everybody. This is why my food mapping masterclass is one of those things where people come in for something like, I just have tinnitus, I want to get rid of it. It's like, it's digestion and food, and it's a one and done. You can solve that problem, right? That being said, there are people with refractory tinnitus, ringing in the ears, that nobody can treat, nothing. They really have done everything in the planet. What's a hidden cause they don't know about?
The misalignment in the upper neck. Those patients, I've seen it multiple times, that even on their first adjustment, ringing in the ears is gone almost instantly. They come up off the table and they're like, for the first time in however long, I don't hear anything. It's quiet. And that's a very new, very powerful feeling for somebody who's had ringing, buzzing, chirping. Maybe it even sounds like crickets in your ear for years without letting up.
Amazing. Okay.
Yeah.
This is great. People want to know more about that infrared device used to look at nerve function. Is that something that's commercially available or only to practitioners?
So I'm sure you could buy one, but you need the practitioner to know how to use it, right? The device is called a Titron. It's actually made here in Iowa. It's registered with that.
Of course it is.
Yeah. Right. Actually, right down the road. What was I going to say?
You need a practitioner to be able to learn how to read the data, because there's patterns. See, this is what we do with hormones, is that people don't realize, like, so here's the thing. People are like, can I just get a test for my hormones and that's call it good? And I'm like, it's not actually where, like, the one measurement is in the normal range. It's like, there's literally a pattern in a picture that shows you the function, the underlying function or dysfunction of the hormonal system. So I was watching you with looking at the scans from my neck, temperature of my neck. What kind of patterns? What do you see? Like, what's your superpower with that?
Yeah. So what we actually don't want to see is a pattern. We want it to always be changing, shifting, right? You're like, oh, wait a minute. My scans look the same. That's bad. So your body and that heat in your neck and your nervous system, all the nerves in your body should be changing with the environment that you're going through. That should change every second of every day as your body adapts. That's what it was designed to do. When it's stuck, that's when you start to see the pattern. It's like your fingerprint. It will always go back to that. And our goal through our adjustment, get you out of that, get you back to how you're supposed to be. So patterns are bad.
Patterns are in your line of field.
Yes,
Dr. Maggie sees patterns that are very specialized.
Yes.
But that being said, the lack of a pattern is really important too. Like, I love this whole thing where I talk about how knowing, like, what something is, like, if a test is positive, something, aha, that's what it is, eureka. Like, most people expect that's how medicine works or good medicine works. I actually think it's even better when you get a negative test result, because then you know what it's not, because then it points you closer and closer to the truth. It's literally the breadcrumbs you need to figure things out. But a lot of people miss these as breadcrumbs. And because the test comes back negative, they think, well, this is the end of the road. And I'm like, this is the start of the journey. I know exactly what's next.
And that can be frustrating for patients, getting a negative test.
And when the doctor tells them there's nothing they can be done.
They say there's nothing wrong. I don't know how we can help you. There's nothing you can do. That negative test can be frustrating. But again, it's a good thing, because now it points people like us in the right direction. It's not this. It's not this. It could be this.
Well, and here's another thing. Kelly Norman, about the ringing in the ears. All of you guys, I'm shouting out, hello, Kelly Norman. Who else is here? All right, everybody. And Regina says, okay, thanks for answering my question. So Kelly Norman says, yeah, the ringing is loud in the summer nights as well as MS symptoms, multiple sclerosis. Multiple sclerosis is an autoimmune attack against the nerves in her brain. So what do you guys think is the likelihood that the ringing in her ear is linked with an autoimmune attack against the nerves that innervate her hearing? What do you guys think? Type that in chat, right?
100%. And that's not probably the only autoimmune condition. Like I have connective tissue disease, and I also have sometimes ringing in my ears, and it only started once I got the connective tissue disease. So I know there's a connective tissue there as well. There must be, or is that correct? I mean, that can contribute to the tinnitus as well.
It is. And then I'm going to blow your minds, everybody who's loving this discussion. If you're loving this discussion, put boom in chat for me, please. Okay. Stay longer. I'm going to stay longer to give you a really big pearl. Yes. Give me some love in chat. Give me a boom in chat, everybody. All right. And if you're loving Dr. Reis, right, Dr. Reis, REIS in chat right now, Dr. Reis, exclamation mark. He's staying here after hours and opening it up and blowing the lid on this. So I would love it. Oh, thank you.
Getting lots of booms.
All right. So all of you with tinnitus and ringing in the ears, okay? In the ears, there's little bones, right? But all around the little bones is connective tissue. Okay. So they're little ligaments that actually hold these bones together so you can hear. Now, ligaments stretch and move as a result of hormonal shift.
Woo!
Okay? Think about it this way. When a woman gets pregnant and over the course of her pregnancy, the ligaments in her hip and pelvis moves and goes wide open. Yes. Why? As a response to hormones. So how many of you with tinnitus and ringing in the ears, think about this. It started as a result, either monthly cycles, it can come and go, or it happened after the birth of one of your children or during pregnancy. Ooh, you got a Dr. Reis. Look at that. Just one. Ooh.
There's many.
Ooh. All right. And then women going through perimenopause and menopause. So it's anywhere between the age of 38 and 52. That's when the tinnitus started or got worse. How many of you notice it's hormonally linked tinnitus? Put hormones in chat if that's you, right? So I want to let you guys know that by testing, learning, and balancing and fixing your hormones. Balancing your hormones, not just mean you go get thrown on some hormones. Balancing your hormones, you can actually change the integrity of the connective tissue to resolve tinnitus and ringing in your ears. Boom, take that to the bank. Oh, we got some hearts.
Yeah, love that.
In colors. In colors. Thank you, Regina. Oh my gosh, I love this.
Yeah, people are really getting a lot out of this because what I'm realizing is both of you as practitioners can help a wide array of people with these otherwise untreatable, unsolvable conditions. And there's a way. That's what I'm hearing from this discussion is if you're not willing to settle, if you're not want to give up and just live with symptoms of chronic pain, tinnitus, TMJ, whatever it may be that we've talked about today, plus more long haul symptoms, fatigue, there's a way. You can go and join one of Dr. Maggie's programs and start there. And then if you still want additional help afterward, because she's led you down that path, you can seek out care with somebody like an Atlas specialist.
Right. I know we're trying to wrap up, but this is so good. And you guys have been so good in the audience. I'm serious. We're staying longer because you guys have been so responsive in chat. But I love this question from Sight Reading Creative, watching from YouTube. By the way, all of you who are not watching from YouTube on YouTube, we're going to provide a link. Jump to YouTube right now and subscribe to the channel, okay? Because that's the only way you're going to get notified. In about a week, we won't be able to go live in the group. So how about for a man? So did you know that hormone changes happen for a man just the same as a woman?
Menopause?
There's menopause. There really is. And there's adrenal fatigue. If Dr. Jason was here, he'd be jumping up and down about sharing his experience. So I'm going to let you guys know that hormonal shifts affect men just as much as women. Timing is a little bit different as to when, and how it appears is a little bit different. But we have John who's in our program right now, and I think he's in his late 30s or early 40s. 10 years he's been dealing with POTS. And when I looked at his hormones, we reviewed his hormones the other day, it is going to freaking change his life. It is going to change his life, and it makes me mad. It's maddening to me just how hormones are ignored, not only in women, it's even more ignored in men. It's almost taboo for a guy to go ask for his hormones to be checked. And it's just the ignorance and the lack of education in the medical providers out there for hormonal balance in a man is staggering. And worse yet, most people, even if they manage to test his hormones, maybe testing one hormone and just throw him on a bunch of testosterone, throwing you on a bunch of testosterone doesn't mean that your hormones are balanced. And I don't know how many men continue to have health symptoms or worsening health symptoms as a result of being on high dose testosterone. So I'm talking hormone balance, necessary for both men and women.
Okay, boom. And just to lighten the mood just for a moment, Kelly said, I actually asked my chiropractor to marry me when he fixed my sprained neck because it felt that good, right?
Well, he's partially taken and I'm partially taken.
You guys are in committed relationships.
We're getting married. Off market, sorry.
Off the market. I know you get propositioned at times probably because you really are, both of you help people feel so much better when they never thought, no one else has been able to help them. So you have very similar lines of work in that regard.
You know what the funnest part of this live is? And I'm going to ask you guys, isn't it fun to see like doctors that are like truly led by curiosity? Like we have been geeking out this whole week. I've been pummeling him with questions. He's been pummeling him with questions. We've just like, we've been just geeking and nerding out. And medicine can be fun. Like health, your health journey can be motivated by curiosity, excitement, hunger, passion, fun. Like where the hell did that go? And that's why I flew all the way here, and I am relentlessly searching for answers always, not just for me, but so that I can learn experiences and give you firsthand experience.
Well, and that's what makes you so valuable, both of you, because you're getting excited and you want to learn and you want to know more. And that in turn helps those who you're working with, because how many times people out there, if you've been to a doctor and they haven't picked up a textbook, learned anything since they were in school, they haven't done anything to learn new information. And it can be really frustrating when sometimes you feel like you're more informed on current trends, ideas, topics, and ways to help than they are. So a big shout out to both of you for leading with curiosity and always bettering yourself. And they said, yes, medical nerd heaven.
I love it. All right, B. So here's the thing. If you guys want to learn more about me and our Transform programs, we have a ton of different programs to deal with a variety of different issues. You can go ahead and book a chat with our team. We're going to put a link in chat book a chat and it's a quick phone conversation with a live member of our team. Just do that so we can learn more about you and we can figure out what program or programs would be a good fit for you and what results you really need. And if, I want to know more of what's going on and you want to know if we're able to help you. So get on the phone and chat with us. So we'll give you a link to book a call with our team. Now, Dr. Reis, what can they do if they want to find you?
Yeah, great question. So you can check us out online. We're at Iowa, because we're in Iowa, right? IowaAtlasSpecific.com, or they can call or email. So we have both our contact information there on our website. And I also have a form. You just fill it out. We can do the same thing. We can hop on a call no matter where you're at and try to find somebody close to you. Or if you're in Iowa, we'd love to have you.
There we go, everybody. So that wraps up my week in Iowa. Tomorrow's my last day. I would love to take some pictures of my pre and post scans on my temperature reading. If you guys want, I can share some of my x-rays that I received. We didn't even have time to go into the depth of the kind of digital x-rays that Dr. Reis took and the evaluation that I had with him. I learned a ton about how to read x-rays as the way he does. That was really great. So if you want, I can share more of that on social media. I can make more posts about it. You guys were a great audience, everybody.
Yeah, this was a really lively discussion. Thank you to both of you for putting this on. Everybody is saying thank you. They really appreciated learning all of this. And hopefully it sets everybody on a path to feeling better with whatever it is they're dealing with.
That's a wrap, everyone. Have a good night. Bye from Iowa.